Hello and welcome to Health Watch. This is the BVI HSA's program where we focus on all things healthcare. My name is Damian Grange and I am your Marketing and Public Relations Manager. Today's episode, we will be focusing on mental health. We are in October, which hosts Mental Health Day, and we have in studio Dr. Virginia Rubaine and Dr. Jardine Torno. Dr. Rubaine is the Director for Mental Health Services in the Virgin Islands, and Dr. Torno is our resident psychiatrist. Both of you, welcome to Health Watch.
Thank you for having us.
Thank you.
And we're in our new studio.
I love it. It's beautiful.
All right, good. We are here, obviously, to talk about mental health. And I know you guys are very much present in the community. But we're going to start with you, Dr. Rubaine. It's World Mental Health Day coming up, and I know you have a number of things planned. So let us know what your theme is for this year and what you have.
So this October 10th, which is the International Celebration of World Mental Health Day, the theme this year is mental health is a universal human right for all. And that's very important because what the World Health Organization wants to do is create access to services for every person living on this planet. So this year, we're doing something that focuses on our children and adolescents, and we're going to be having a competition where students get to use their creativity and design murals and walls that speak to the theme.
Wow.
Yeah.
That is great. And while we're here, let's focus on some of the barriers that you're seeing as it relates to mental health.
The biggest barrier to persons accessing services right now in 2023 remains stigma and discrimination. And it's not stigma and discrimination against being mentally unwell. We stigmatize and discriminate against persons who actually seek services for their mental health challenge. It's very bizarre, yes, for their mental health challenges. So this is my 20th year in the service, and what I have recognized is that when persons are unwell but not seeking services, families in the community aren't as concerned as when they do seek services and they're getting intervention. So for a lot of persons who are suffering, they don't want that backlash from their community, from their loved ones, so they suffer in silence, which is unfortunate.
Which is why your department launched the anti-stigma campaign, and this is in partnership with
Unite BVI. So Unite BVI has provided us the funding to start our Mindful campaign. And for those of you who are familiar, the Mindful campaign was launched in the UK about 5 years ago. It was very successful. It's an evidence-based campaign that seeks to change attitudes as it relates to stigma and discrimination.
Right.
So we had the opportunity to be selected along with Bermuda to pilot the campaign here in the Caribbean. So we had our own branding, which is Be Mindful and Let's Start the Conversation. And the Unite BVI Foundation graciously gave us 100% funding for the endeavor. Harney Westwood and Regals has also partnered with us, and we were able to generate scholarship monies to further student studies in mental health related fields. So it has been a very successful campaign.
That's amazing. And on the subject of stigma, let's talk about stigma surrounding mental health care and medication usage, especially in this community. And I think I'll go to Dr. Torno for that.
Well, thank you very much for asking about that. Like what Dr. Rubaine has said, the stigma doesn't only involve people coming into the service, but also people stigmatizing those who come into the service. That would include the thought of giving medications as well, because there's a lot of misconceptions about mental health medications. Like people would just readily accept prescriptions from a general doctor, but if it comes from a psychiatrist, they would have second doubts or second thoughts about whether they would need to take it or not.
Right.
They probably most of the time bring the prescription home without intent of feeling it until they speak with their relatives, they speak to another person. The stigma surrounding medication, I think, comes from the olden days, wherein there were old medications that caused some side effects that are not aesthetically pleasing, like people would walk slow, people would have like shakiness, people would have what they call a zombie-like appearance. But we educate our clients now that there are newer medications that are available that have lessened those side effects. And we also educate them about the physiology of mental conditions, which is that it's a hormonal imbalance. Like when you have a lady who's menstruating, and then he or she would have changes in the mood, right? That's a hormonal imbalance. Mental health is also a hormonal imbalance. Like with depression, there are certain hormones that are, lacking, and with psychosis, there are hormones that are more than enough that causes the symptoms. So what the medication does is to balance those hormones in the body so that the person gets better. So in terms of medications, there have been a lot of advancement. There's still a lot more way to go, but in terms of the available medications here in the BVI, we have the second generations and the third generations already, which have less side effects than what people used to remember in those days.
Right. So I was listening to a local program, and the conversation surrounded Terrazine, I think.
Thorazine.
Thorazine, but I think the pronunciation on the program was Terrazine.
Yes.
And it if you asked me, it was a conversation that would contribute to the stigma as it relates to mental health care and medication. Do we still use that? Because to my understanding, that is not a medication that is in use anymore, especially in this territory.
That medication hasn't been in use for the last 50 years. And I have a personal story about Thorazine. My great-grandfather died because he got too much of the medication, unfortunately. And in those days, we didn't have a mental health program here. And he was being transported to Antigua. So having had that personal experience, I am certainly educated about what medications are available and what these medications do. And sometimes just some simple information would allay our fear. Dr. Torno is right. The drugs that we have on the market now are not those drugs that our great-grandparents were treated with. And a lot of the people who are purporting those mythologies never saw anybody on those medications because they haven't been in use for the last 50 years, give or take, depending.
Right.
Our close proximity to the U.S. really gives us access to all the latest available up to the minute formulation. So, I don't think there are a lot of people alive who could really remember that.
Right.
The other thing that I would add is that when people don't take their medications as prescribed, then sometimes they develop unwanted side effects. So that's why it's so important to listen to your care provider and follow the instructions.
Right. And that is not just for mental health related medication.
Yes,
anyway.
that's what I was supposed to add. Like, all medications would have side effects, and it just so happens that there's a stigma about mental illness, plus the stigma about mental health medications. But I want to add as to what Dr. Rubaine has said, chlorpromazine, it still exists. It's not that it's obsolete. It's still given occasionally. The old medication still has a purpose, but of course, you have to make sure that the one giving it is a person who knows about medication, so that they will be able to tell you how to take it, what are the things that you have to look for. In fact, Toracil is a medication that is also used for vomiting. Like if you're nauseous, in the olden days it's used as an antiemetic.
Okay.
So not before it was discovered to be a psychiatric medication, it was given to people who have like intractable vomiting. It was always nauseous. So that's where it came from, and then they just found out that it can be also helpful for psychiatric conditions.
Now, how do we? I mean, having the conversation helps, but what programs do you have in place to? Because the reality is, if there is a stigma, and there is, we must try our best to educate the community on mental health, its medication surrounding mental wellness, and its usage. What are we doing in that regard?
Well, the anti-stigma campaign has champions, and so champions are persons who work with the campaign who have lived experience with mental health challenges, and some of these persons take medication. And if you go to our Facebook page on mental health services with the BVI HSA logo, you will see personal testimonies of how taking medication improved their symptoms and improved their quality of life. So we're getting real people to share with the community. This has been my experience. This is what worked for me. We're always doing outreach. If there's a health fair somewhere, mental health is there.
Yeah.
And we're available to give out information and talk with persons in the community who have questions. And I'm telling you, I've been doing this for 20 years. People come and ask about the wheelbarrow. How come your medications make people push wheelbarrows? And we try to educate them and explain to them that, first of all, nobody's pushing a wheelbarrow. What you're seeing is retarded psychomotor abilities, and sometimes this happens and we try to explain to them to the best of our ability.
I also don't think that people have an appreciation for what the team does, simply because they may see folks being functional, not having an appreciation that these folks are in fact compliant with their mental health care.
Exactly.
And then they may see somebody acting irrational, let's use that word for example, and they start to say, oh, mental health is doing nothing.
Yes.
Talk about that.
It's you lose when you win and you lose when you lose. So we can't win for trying. So when we are assisting persons with intervention, there's a lot of resistance, there's a lot of negativity. Just last week, my nurse was telling me that, she's out in the community doing her rounds and trying to administer medication, but there's almost an element of danger because you have persons in the community saying, don't give that person their medication. But then when a person becomes unwell, they're calling us and we must come now to assist with this person who's not doing well. It's rather frustrating. Make up your mind, pick a struggle. Either you want us to help this person be the best them that they could be, or you want to roll the dice and see what happens with them not getting intervention. So sometimes it's a bit challenging, and it's kind of mind-boggling to me that in 2023 people still have those attitudes. Or there's people go on social media or online and research anything in 3.5 seconds, but can't be bothered to research, well, what does schizophrenia look like? What is that like for the person that may be suffering from it? What are some of the common behaviors that we see with persons with schizophrenia? Persons with depression, with psychosis, because it's not always schizophrenia. There's a myriad of challenges because everybody's chemistry is unique. Everybody's family history is unique. And if you're from the Virgin Islands, you know what I mean about family history and how we're all pretty much connected genealogically. So if you have a relative who suffers from chronic mental illness, there's a possibility that you might as well. So it's just kind of weird to me, I'll be honest, that persons choose to not seek information in 2023.
Yeah.
It's like it's the 21st century.
And in most cases, family members are involved in the care, and so you generally don't get the pushback from those who are involved.
Right.
It's usually persons in the community who may have no affiliation with
Or no understanding of what's happening.
and no understanding of the situation, and just going based off pure emotions, right? And I agree with you. Education is at the tip of a finger, and we should seek to, especially persons in the public space and have public influence. Don't just put out information without doing your research. It's important because you don't want to create a situation where you have to be investing a ton load of money, whether it's being sponsored, supported or not, in an anti-stigma campaign when we really don't need to be here at this stage.
In 2023.
In 2023.
Don't forget it's 2023.
Dr. Rubaine, a number of things happened in the course of the BVI in recent times. Recent times back in 6 years.
You wanna start with the knowing the art floods in 2017?
The floods in 2017. And so I would imagine that these obviously unplanned events may be traumatic for a community. And I know you may not have specific numbers, but can you speak to the stats as it relates to post-floods Irma pandemic of persons now seeking mental health care?
I can say unofficially, we've definitely seen an increase in persons utilizing the service. To give an exact number, we don't have a national register. So when I joined the service in 2003, we really didn't have private practitioners. Now we have a plethora of options for persons to utilize. So there needs to be a national stock taking of who's going where and who's doing what. I was recently in a meeting where we have the opportunity to utilize an external agency to collect that data, and so that's going to be coming on stream very soon. But to say that we have hard numbers, because it wouldn't be accurate if it were just to give the public and not the private side.
And I think this question is for both you and Dr. Torno, because I'm thinking that you would see a different, well, let me not preface the question. In terms of mental health conditions, what is the most prevalent you're seeing in the Virgin Islands community?
Doc, you want to go first?
In the British Virgin Islands, since all the things that has happened, there have been an increase of people coming in for anxiety, like panic attacks, generalized anxiety disorder. There's also an increase, I noticed, in substance use, alcohol consumption, alcohol-related conditions, aside from the cannabis and the cocaine use.
Did he just say cocaine use?
That's right.
We're seeing an increase.
Aside from the usual,
Okay.
there was an increase. I noticed like an alcohol-related disorder, like people are coming in with more alcohol-related symptoms like withdrawals, anxiety, depression, and they use alcohol to cope. And you know, in the BVI, there's a lot of people who drink, right? But most of them, they don't seek help because, you know,
Drink is the meds.
yeah. So they
And that medication has no stigma attached to it.
And they're the walking wounded. So if they're still able to go to work and function in
Yes.
some
Yeah.
way, it's only when you start having issues in your daily functioning that it becomes a problem.
And at that point, then,
They need
they
services.
seek services.
and that's the same for you, Doctor.
I've definitely seen a significant increase in the mood disorders, anxiety, and depression. On my end, it's more depression. People are just really, really sad. And I spend a lot of time helping my clients develop skills to cope in healthy rather than maladaptive ways. So you're seeing a lot of deviant sexual behavior too, because that's another way to cope. Ain't the best, but that's what people are doing. And so you're seeing the corresponding interpersonal difficulties from broken relationships, betrayals, STIs. I mean, it runs the whole gamut.
Wow.
And then there's the people that are living above their means and can't see their way out.
Right.
And things are getting harder, yeah.
So that would definitely bring on some degree of
Stress.
anxiety and stress. I
Yeah.
agree. Now, we're here. And for some, it is more a response. We're being reactive. But we need to try our best, in my opinion, to intervene early. And we know in anything, if early intervention takes place, then your likelihood of being well is much better. What are we doing from your department to intervene early, especially among our young people?
Well, we just completed a comprehensive evaluation of all the public schools. So we actually did biopsychosocial evaluations to include principals, teachers, and students so we could get a pulse for what was happening within our school system and what we could do to address it. So we've made recommendations that we're going to present to the Ministry of Ministry of Education, so that they can partner with health so that we can head these things off at the pass. So some of our recommendations include psychosocial days for the teachers.
Wow.
That are standard and mandatory, that they take a teacher day and they go off and they engage in self-care. We're also going to restart Return to Happiness in the schools. That was the UNICEF psychosocial program that we were utilizing after Maria.
Yes.
And we're also going to be conducting process groups for teachers and guidance counselors in the school, hoping for a trickle-down effect. We've also recommended to the ministry that they have parenting sessions where they have these mandatory meetings that parents must come to and get tips, skills, resources that will help them be more effective in parenting their kids.
Right. Great. Sounds like amazing things on stream. And obviously, once those recommendations are implemented, we can definitely look forward to a healthier community and a mental health thriving
Absolutely.
community. Please let us know some of the home care that we can do. Maybe we could speak about it from Dr. Torno's perspective, and then Dr. Rubaine from the psychosocial support perspective, that persons can engage in to at least prevent, especially if they are experiencing anxiety and depression.
I see. Like a stress reduction technique?
Yeah.
All right. So
I do homie toto. I don't know if that works.
deep breathing.
Okay.
Yes. So there's a lot of people who are undergoing stress right now, and what I usually tell my clients is to always remember that nothing is permanent. Like, things will pass, and they just have to click onto hope. Now, hope is such an abstract thing, right? So I want them to look at things that they have that are going for them. So I ask them to put up a gratitude list of the things that has gone well. And I also teach them how to do like intentions in the morning, like when they wake up, this is what I intend to do and intend to be, intend to feel. I also teach them about being mindful, being aware of their own self, their feelings, validating their emotions, whether it's positive or negative, especially if it's negative, like when they don't feel good.
When you say validating emotions, because if you say validate my emotion and somebody messes with me at work, I'm going to cuss them out. That's validating my emotions. Is that what you're saying?
So for example, if you're angry, if you are angry, Damien, and then I would ask you like, what was the source of the anger? And then, you know, if it's a valid reason, then you say, yes, I'm angry today, and my anger is valid. That's validating, not validating the actions.
Oh, okay.
After the
Thanks for the
emotion,
clarification.
yeah?
I was just about to say, Dr. Torno
Yes.
told me.
So just to validate, because we live in a world where people are very like uncomfortable with negative emotions, like they don't want to discuss negative things. So you have to know when to feel not okay.
Right.
Like it's okay not to be okay. That's what we always hear right now, right? So I always tell them that sit down, take a deep breath, examine your emotions, and validate them if it's rational, and then take a deep breath, write down put on your gratitude list, and make a plan afterwards. It's always good to also have positive coping mechanisms, like exercise, connecting with people, connecting with the community, getting yourself involved, and also spending some time for yourself too, like choosing a time in your busy schedule to just focus on yourself, to be selfish for the meantime, and just make sure that you take care of yourself, whether go to the spa, read a book, listen to a nice calming music, or dance, or whatever you need to do, so that you can just de-stress.
Right. And Dr. Rubaine, I'm afraid of your answer.
My answer is a little more technical, but it aligns with what Dr. Torno said. So I teach my clients about the feedback loop, how our thoughts are the engines that generate our feelings that influence our behavior. And if you know what you're thinking, then you understand what you're feeling. And if you understand what you're feeling, you can control your own behavior. If you want to change how you're feeling, then you need to change your thoughts. And in changing your thoughts, that cascade will go around to your behavior. The other thing that I challenge my clients to execute is to know what they believe and why they believe it. What's the philosophical framework from which you live your life? Because what you believe and value is going to influence what you think. And for a lot of people, they don't really have a framework. So their thoughts are scattered and all over the place and very vulnerable to what's happening in the environment. But if you have a framework, say using Christianity as an example, then there's a built-in optimism and hope in Christianity that gives you something to look forward to because it hasn't happened yet, right? The promises of God are yes and amen, but they haven't happened yet. So I encourage people to go a little deeper beneath the surface so that they could take responsibility for how they're thinking and how they're feeling.
Right. Well, on my gratitude list, I'm grateful that we have a department that is staffed with people like yourselves and your team, because I know that the community is better because of this department. And it's located right here at the BVI Health Services Authority, at the Dr. Deolanda Smith Hospital. Dr. Rubaine,
Yes.
what's to come for mental health care in the territory?
So lots of big things are happening. So we just recently conducted the first of its kind independent study here in the Virgin Islands on professional women and their mental health and well-being. And that study was just recently published, and I'm over the moon because when I was a young scientist looking for information on the Virgin Islands, there was nothing. It was always the bigger Caribbean countries. So now we're officially on the map, and I'm super, super happy about that.
Great.
The anti-stigma campaign continues. I encourage everybody in the community to go to our Facebook, Instagram, LinkedIn pages and peruse the information that we have there. There are daily tips that go on. And of course, our contact information if you ever need psychosocial support so that you can reach us. Future. So we are currently awaiting the renovation of our space here at BVI HSA. And as soon as funding is released from the Ministry of Health, then we're going to be able to offer some comprehensive programs to include a day treatment program.
Nice.
Yeah, so basically for persons who are vulnerable in the community and don't have the familial support, we're going to create a safe work environment for them in this day treatment program that allows them to earn money toward their care.
Wow.
And gives them something industrious to do during the day, and it gives us the opportunity to manage their medication regime and ensure that they're getting all the services that they need. So I'm particularly excited about that.
That's great. And Dr. Torno, can you summarize for us the evolving landscape as it relates to psychiatric treatment in the territory?
Thank you for that. I just want to add on what Dr. Rubaine has said. I'm also excited about bringing back the youth groups.
Yes,
Yes,
we're bringing back our.
Yes.
I'm sorry, and we're also bringing back our children and adolescent psycho therapeutic groups and social skills groups. Yes.
Awesome.
Yes. So, thank you for asking me that. I arrived here in 2013, and when I arrived here, there has been like people who would ask me so much about confidentiality before actually seeing me. So they're actually worried about people knowing that they're seeing us. With the evolving knowledge, the increasing knowledge about mental illness, even though we're still not there, there have been a lot of changes in terms of people's knowledge and acceptance about mental condition. We see a lot more people coming in, and especially with the anti-stigma campaign. And after the
evidence-based, so you're already reaping the benefits of the campaign.
Yes. And also
That's
after
great.
Experiencing all this, the hurricane, the pandemic,
the trauma.
People have been more accepting to seek help. Of course, there's a long way to go, but that is the main thing that I noticed from when I started in 2013. The other thing also is to acknowledge the efforts of the authority in bringing newer medications. Because we started with the old medication, that's where the stigma is coming from. Like, people don't want to experience the side effects, and those are the most common questions I would have whenever I speak to families about medications. And now we can say that there have been newer medications. Not all medications are perfect. There will be side effects. I would agree on that. But as I've said, these newer medications offer more benefit than the side effects, and as if you compare them with other medications, it's about the same in terms of like the dangers in the side effect profile, generally, right? So in that aspect, there's also been a good improvement in the way we treat patients. We have our behavioral unit ward as well.
By the way, the behavioral health unit is 5-star.
It's beautiful.
Yes.
I love it. Yes.
It is 5-star.
Panoramic views
Panoramic.
of
Exactly.
downtown Roadtown.
Spacious and
Yes.
And I must say, give a shout out to our dietary team. The food is impeccable.
of course.
That doesn't mean you try to come here, though. Don't try to come
Yes.
here.
So when I started, we usually get like either 2 beds from
Medical.
the other services. We have the 2 lock rooms which are antiquated.
Yes.
And we have our own behavioral health unit now that has lock rooms still, but it's more like up to date with the standards of how we care for the human rights of our clients. So it's the padded room. We don't restrain them, unlike before. We have camera rooms in the ward, so they're very up to date.
It's more humane now.
More
Yeah.
humane.
Yeah.
That's amazing. Well, I know you mentioned that persons may be able to go to the social pages to contact, but any specific lines that persons can reach you, Dr. Rubaine, if they need to contact the service?
Absolutely. They can reach us at 852-7670 or 852-7675. If you can't remember our extensions, you can always call the switchboard and be transferred immediately.
All right. There you have it. Mental health is indeed a universal human right. And here at the BVI Health Services Authority, we're ensuring that we make that our top priority. Thank you, Dr. Rubaine and Dr. Torno, for stopping by our new studio and for being on Health Watch this episode, educating the community about the work that is being done and also what is to come. Thank you so much for joining us, and tune in next time when we have another episode of Health Watch. I am Damian Grange, and it was my pleasure being here with you.